welcome to Facebook Live tonight. I'm Jedd Gyorko, Morgantown native, born and raised here. The topic tonight is going to be women's health. My wife Carly and I just had a baby here a little under a year ago. We chose Mon Health because this is the best hospital around. We enjoyed our visit. I'm joined here with the care team. I got Dr. Prettyman and Dr. Arthurs. Thank you guys for joining us tonight.
Thanks for having us.
Can you guys tell us a little bit about yourselves, your specialties?
So sure, my name is Shane Prettyman, one of the OB/GYN doctors here at Mon Health. Grew up in West Virginia, did schooling here, went away to Virginia for residency, and then came back here about 10, 11 years ago, and have been here since. And love the hospital system. Love just working in the community, taking care of Morgantown folks.
Well, I appreciate you joining me, Dr. Arthurs.
I'm Erica Arthurs. I'm also one of the OB/GYN doctors here, practicing general OB/GYN. I'm also a Morgantown native, born and raised here, stayed here ever since, and once I started practicing, chose to practice here at or Mon Health, and have loved it ever since. Yeah.
Well, thank you guys for joining me. I don't know if you guys realize this, but both of you were actually supposed to deliver my baby. I'm not sure what happened with that. Bahamas, beaches. But thank you guys for joining us. Let's get into it. Let's talk about the Family Birthing Center. What makes it so special?
That is a great question, but I think we could talk all night long. I think about what makes Mon Health a great place to have a baby. I think in general, the hospital is wonderful. I mean, I give a lot of credit, I think, to the nurses. When you're there, if we're talking about having a baby, I mean, you're there for several days, in labor potentially for a long time, or maybe you're there for a scheduled surgery, scheduled C-section. But your nurse is kind of your person who is with you. A lot of times people talk about, bringing, a support person with them, paying somebody to come and be that person. But in my opinion, when we have that conversation with patients, that's your nurse, and she's there with you the entire time. We're there too, but your nurse is there, and the way that she supports you and gives, guidance and direction and advice on, what to do, when you're in labor. I just think is invaluable. And when I go into the nurses break room and you look on the bulletin board and there's all the notes there that families have written back, thanking everybody, but it's thanking the nurses, and just you read those and you think that is exactly why Mon Health is so special, is because the care that they got from their nurses and their providers too. So
I agree. I think being both a doctor here and then also having been a patient here, having my second baby here, just the care that the nurses take of everybody is amazing, and it's really just one-on-one care, and you just feel like you're part of the family. And the birthing suites are beautiful and very comfortable for the patient and the family. We have lactation support, so after the baby's here, if you're having difficulty breastfeeding, we really have a lot of people that can come help you and support you and try to get you to your goals of breastfeeding.
Yeah, absolutely. Couldn't agree more. Super comfortable, like you guys said. It couldn't have been better. Some of the best nurses I've ever been around. Let's go into birth plans. What are you guys' thoughts on those? Any ideas on this?
Sure. So, and it kind of ties into what we're talking about. So, a lot of, when you have a baby, of course you want it to go well, and you want it to go exactly how you want it to go, potentially, right? It's how you picture it. So, a lot of times patients will bring a birth plan. I remember when my sister was pregnant with her first, and she said, "Hey, I hear about this birth plan. What is that? Do I need to print something off on the computer and bring it?" And sometimes patients do that, and when they show it to us, I think sometimes we and nurses chuckle a little bit because
babies always have different plans.
Well, yeah. or kind of what I was thinking is the stuff that they write and the stuff that they want is exactly what we do anyway. Right. And I think that the idea of birth plans comes up, unfortunately, because there's places that is not the standard, right? I mean, that the baby isn't with you the entire time. The baby is off in the nursery. That back in the day when it was a lot of formula, a lot of pacifiers and stuff like that. So I think a lot of people thought, I need to write down exactly what I want to happen. And then when we read those, that is, what we do anyway.
Yeah, kangaroo care, so putting the baby directly on mom's chest, letting mom and baby bond for the first hour. Those are things that we're doing with our patients that a lot of times are on their birth plan, and like Dr. Prettyman said, that's our standard of care. So, yeah, and we're a baby-friendly hospital, so which means we're certified. We have all the lactation support. We really promote breastfeeding if that's what you want to do. So making sure baby's skin to skin, keeping baby in the room, rooming in, and really providing the support so that babies can feed well in the first 24 or 48 hours and establish a good breastfeeding relationship with mom.
I think, going back to birth plans are good in that you're thinking about what you want to happen, right? I mean, you're thinking about, do I want an epidural or do I not? Do I want to breastfeed or do I not? Do I want to labor in this position, push in this position? Do I, and those are, you're thinking about what you want. And, the reason you come to the office for 9 weeks, I mean, sure, we check your blood pressure and do all that type of stuff, but more than anything, our job is to be educators. So we educate, the patients on, what's about to happen. So when they come with birth plans, and it just basically brings up topics to talk about. So to a certain degree, it's a good idea to do that. But it's maybe just a point to reassure the patient that what they want is typically what we do anyway, regardless of if it's their idea and on a piece of paper or not.
Awesome. Do you guys offer any mental health support for postpartum moms?
Oh yeah, we have a special program called the P3 program, so progressing through the postpartum period. We have a nurse coordinator that's specifically assigned to all of our postpartum patients. She checks on them, checks in with them if they're having more difficulty adjusting postpartum. We have somebody that reaches out to those patients. So we have really great support for our moms who may be struggling a little bit with mental health issues or postpartum depression. It's really common. So we have support for those moms who are struggling.
Yeah, I think just recently we got, the P3 program got another grant to help fund it further, and they're looking at how to use that money to further expand it, whether it's bringing in, another provider or, social worker or counselor or therapist or somebody like that. So we have the services in-house, for patients that need it, so.
That's excellent. As a dad, obviously I'm here. It's not too much to add on the women's health side, but as a dad, what should I do for my wife while she's in labor? What can we expect to be doing, or how can we help? That's what we ultimately want to do. As dads, we want to be there, we want to help. What are the small things or ways that we can do to make things easier?
Yeah, I think, great question. We always, as husbands, fathers, you want the best, for your wife. So you want her to be taken care of. So my personal opinion, coming to Mon Health to have a baby, right, is where I think that she will be best taken care of. So help guide that decision. But, just be there for her, when she's in labor. There isn't anything specifically that you need to do. I think sometimes, the patient, the mother and husband are in a very vulnerable situation. They've never, if it's their first baby, been in that situation, so obviously they're nervous. But if you're, there for her, right, don't have to, hold her hand, sit beside of her, pay attention to her, right? Don't be over here on your phone, right? A lot of times we kind of joke sometimes epidurals are better for the husband than they are, for the patient, just because, when you see your wife in pain, it makes you very nervous often. And if she has an epidural and relaxed, you're more relaxed. So I think, just being there for her, even if you're nervous as all get out, right? I think being there, just paying attention to her, getting her a drink of water or anything like that is good. Just listening to her. Yep.
On the doctor's side, any kind of do's and don'ts that you kind of see dads that kind of do, or was something that you would say, let's try to shy away from this, or?
If you're feeling dizzy or lightheaded, sit down immediately. Don't try to keep standing, because we've seen dads pass out before. But yeah, I think I agree with what Dr. Prettyman's saying. Just be very supportive. Try not to be too negative. Yeah, we see a lot of dads, coaching through pushing, and that's really helpful for moms too, because they really need that support. But.
And or put on a pair of gloves and a gown and catch the baby yourself, right?
I'm not sure about that. We got a question coming in that says, asking about my experience here at Mon Health, and it was great. It couldn't have gone any more smooth. Kind of what I did was pretty much this. Carly had C-section, so I made sure I stayed behind the screen. There was nothing on the other side that I wanted to check out, but just hold her hand, just be there, kind of let her know everything's fine. She's a really hot body, so cold cloth kind of was what she needed. That was.
Bring your phone,
Yeah,
take lots of
a ton of
pictures.
pictures,
You got to
ton
take
of
all the good
pictures.
pictures and be the photographer, the
Exactly.
Instagram dad.
That was my
Yep.
experience. I sat there, and I think I did my job.
Yep.
And hopefully it was over soon. So that's where we're going. Let's transition to the OBGYN locations. Where can I find one of those, and where are they at?
So we have our main office is here in Morgantown, right down the street from Mon Health. They're in the little plaza near the entrance. And then we have an office in Fairmont where we see some OBGYN patients. And then I know Dr. McCullough is going to start going down to Minnie Hamilton to start seeing OBGYN patients.
Uniontown.
In Uniontown, yeah.
2 GYNs that are in Uniontown doing GYN care and some early prenatal care as well. And then, Mon Health, their sister hospitals, right, at Preston Memorial, and then at Stonewall Jackson, Dr. Harris delivers a lot of babies at Stonewall Jackson Hospital.
Excellent. So there's plenty out there to go. Just go out there and go find them. Let's see. What do Mon Health's perinatal classes offer?
So Mon Health has always offered classes. COVID kind of put a kink on everything, so they started offering Zoom classes. So right now they are offering Zoom classes, and it's breastfeeding classes. It's kind of a baby basics and kind of a labor what to expect class. It's kind of nice again with Zoom. You're not having to come to the hospital. You can just do it from your own house, and other family members can be involved. So that's a nice thing. But I do anticipate that that'll probably, change back to in-person soon. They also offer tours of the birth center. It used to be kind of group tours, but just recently they stopped because of COVID. But recently they're starting to do, I think, individual tours of the birth center, which I think is a good idea. I'm always a little bit, myself apprehensive when you're doing something for the first time. So, if you've never been to the hospital before, or been to the birth center before, sometimes just walking down the hallway, with a nurse kind of giving you a tour and showing you the room so you know where you are and what to expect. And that brings up a lot of practical questions like, well, what should I bring, personal items and stuff like that. So I personally think tours are a good idea, so we're offering that as well.
Anything to add on that, Dr. Arthurs?
No, I think you covered most of that. The perinatal classes are great, especially for first-time mom and dads. If they've never had a baby before, it really helps prepare you for what's to come and what to expect in the hospital.
It's a lot of practical stuff too. Yeah. We had our first, he's 12 years old, so our first when I was a resident, and my wife, wanted to do birthing classes, and I was like, we don't need to do birthing classes, right? I'll teach you everything, right? And then we did the birthing classes, and son of a gun, I learned a lot, right? I mean, because it was just very practical stuff that you don't realize. So I, again, would encourage, even if you think you don't need to, or even if it's your second baby, especially if you haven't been, to Mon before, to jump on those Zoom classes. They're free, you're there. If you like it, great. If you don't, I mean, it's easy to do.
Exactly. I think a lot of things changed as well. I've had often with the twins when I had 8-year-olds compared to the baby now, how much things have changed. That's just how things are to kind of get more up to date. Why are annual wellness exams so important for women?
You take your kids to their wellness appointments, right? Their 1-year-old, their 2-year-old appointments, even if they're healthy, and that's important because again, going to the doctor makes you think of stuff. The doctor brings up stuff. You have questions, stuff that you may never think about before. And same thing happens if you're, a teenager, a middle-aged, or an older woman. Even if you think you're doing well, and maybe you are doing well, there's lots of things that maybe are asymptomatic that you're not aware of. I mean, it can be as simple as you come to see Dr. Arthurs for your annual exam, but all of a sudden you have high blood pressure and you didn't know you had a high blood pressure, right? So I think that in general is healthy care is important. But then there's a lot of, cancer screening, right? Whether it be your Pap smear for cervical cancer, or colonoscopies or mammograms, or you're talking about your family history. Your grandmother had cancer, and so did your aunt, and so did your sister. Maybe there's something that runs in your family. So hereditary cancer screening is something that kind of with this DNA technology is becoming pretty popular and very important because you can find kind of mutations that run in family that may increase your risk for cancers, and you may need, instead of just your annual mammogram, maybe you need to alternate mammograms and MRIs and do this every 6 months so that you can, you have a higher incidence for cancer and you can catch it sooner. So I think sometimes that's stuff that people don't realize, and even if they're healthy, they should come and, make sure that everything's okay.
Yeah, and I always tell my patients, even though you're not due for a pap smear maybe this year, because we don't do it every single year, we still like to see the patients every year, make sure we're doing a breast exam, because a lot of women are affected by breast cancer, and some things are found on exam that they didn't know about. So I really encourage patients to come every year, because there may be something that they're missing, and that we may pick up on exam in the office.
And the other practical thing is, if you, when I have a problem, I'll call, right? I mean, it's 6 years,
yeah.
right? I guess the last time I saw you was 6 years ago, right?
Yeah.
When I had my baby, right?
Away,
Yeah, as you get busy with life, and then you miss stuff that maybe you needed to have done.
Can you guys walk us through the other GYN services available at Mon Health?
Yeah, good question. So Dr. McBee, GYN oncologist, so your GYN cancers, so uterine cancer, ovarian cancer, cervical cancer, and several others. So he is an OB/GYN like us, and then he did a fellowship in GYN oncology. Kind of bigger, sometimes more complex surgeries. Sometimes, chemotherapy and or radiation is required to treat those cancers. So he is a very, very busy surgeon, very excellent surgeon. So he is another kind of big part of our OB/GYN family at the hospital. Dr. Capella is a urogynecologist. So again, OB/GYN, but then did a fellowship in urogynecology, which is, bladder, incontinence, prolapse, and kind of another special surgery, subspecialty. And then the other thing to think about is, infertility. When I kind of talk about that, so many patients, Dr. Arthur's, I've been trying to get pregnant for a year. I must have infertility. I need to go see a specialist because maybe I need in vitro fertilization. Is that correct?
Not typically just straight off. So a lot of times we'll assess a patient, and we will do the initial workup for infertility. So we can get an ultrasound, do some lab work, see if there's any cause for the infertility, and then we can do some basic steps to treat patients for some of the reasons that they may not be getting pregnant so easily. So we have some expertise in that. And then if we think you need to see a specialist, then we'll make that decision together as you and the patient. But we can start the workup and take care of that.
I would venture to say, we have a lot of patients that come in having trouble getting pregnant, and again, that's why you come for your annual wellness exams and you find out somebody's been trying to get pregnant for a while. The majority of the time, large majority of the time, they never end up needing to see an infertility specialist, because that's stuff that we can help guide them through and walk them through, and lo and behold, they got pregnant without ever having to do, spend a lot of money on stuff that insurance doesn't cover, right, trying to get pregnant. The other kind of on that topic, high risk. How many patients do you hear say, I'm high risk because of X, Y, and Z condition?
Yeah.
What do you think about that?
Yeah, we take care of a lot of patients that have high-risk conditions. We may work with high-risk physicians to take care of them, but for the most part, a lot of the things that patients consider high risk, we can take care of here at Mon Health too. We take care of patients with high blood pressure, diabetes, other issues with their pregnancy. So, we can take care of a lot of that here at Mon Health. The other thing I always think about is patients always think all we take care of is, pregnancy and pregnancy-related problems, but we also do a lot of gynecology care. So we're performing hysterectomies, we're taking care of patients that need help with their heavy bleeding issues. So we sort of work with the patient when they're younger, when they're, in childbearing ages, but then we also take care of older patients. So throughout the whole lifespan of a woman, really we're there to kind of help take care of all their needs.
Can you guys go a little bit more into the risks and benefits of a hysterectomy?
Yeah, risks and benefits. Every woman has a period, right? And most of them don't like it, right? It's kind of that necessary evil. Some women have it worse than others. But if you, again, follow with your doctor, right? Hopefully you're now talking about those. And it's not just surgery, that fixes them. Whether it's, over-the-counter medicines, whether it's, hormonal medications, be it birth control or other medications. Some that are, IUD, so a local, kind of hormone in your uterus, but without, the hormones going throughout your whole body, right? So maybe a little bit less side effects. So there's a lot of medical things that you can do to very, very easily manage or make your periods go away, right, without having to have surgery. There's also endometrial ablation, so smaller procedures, and I'd rather call it a procedure than a surgery, but a procedure that you can do that oftentimes can make your periods go away, but the majority of the time makes them significantly less, less heavy, sometimes not as painful too. Or if you are, if your periods are bad enough or you failed other medical things, they're not working good enough, and you go down the hysterectomy pathway, that's a great option too. Back in the day, hysterectomies used to be, right, C-section incisions, and you're in the hospital for a couple days in a long recovery. And nowadays, hysterectomies are by and far almost always minimally invasive, where you have several small incisions on your belly. You're home by lunchtime, right? You have your surgery at 7:30 in the morning, and literally by noon, you're headed home. And it's still a recovery, but usually it's a few days of discomfort. And, if people, have had a C-section and, now they're talking about a hysterectomy, it's night and day difference. Recovering from a laparoscopic hysterectomy or procedure compared to a C-section is way easier. So there are risks, of course, but the risks are far and few between. And I suppose the benefit is you don't have a period anymore, right? So it's a great option, but again, surgery isn't always the way, but there are multiple options that we can do if you come see us, I suppose.
Yeah, and there are a lot of reasons why people come seek out a hysterectomy, and we can kind of go through the whole, diagnosis and management with the patient. So figuring out what is going on, first of all, and then also giving them options, whether or not you want to go all the way to the hysterectomy, which is a little bit more invasive, or try one of the other therapies that Dr. Prima was talking about and see if that works maybe a little better for them. Yeah.
Great. Gynecology. What do we offer here at Mon Health? And what are you seeing that you think patients would need to know?
Similar to what we said, I think that we kind of have the whole, Mon Health has some distinctions and awards that they've gotten, for their gynecology care. And I feel like it's well-deserved because of kind of the, whether, again, it's the cancer, whether it's the infertility, whether it's the kind of prolapse and incontinence, whether it's just the benign GYN issues, and then, the obstetrical care. I feel like, Mon Health just kind of covers the spectrum regarding women's care. Breast surgery and stuff like that. How about that?
Yeah, we have, we take care of patients that have breast issues. So if you come to us with breast pain or having a lump that you're feeling, we can refer you to one of our surgeons who do breast surgery to do biopsies. We have radiologists that can do biopsies for you. So if you're ever having a problem, you can call us so we can do the initial exam and sort of start the workup process. And then we have people that actually do the surgery here at Mon Health.
So
yeah. So you can kind of stay in the whole system, and we can really take care of you from like start to finish. Yeah.
Breast cancer, you have your surgery for that, and if you need reconstructive surgery after that, there's plastic surgeons here that can do that reconstructive surgery
as well. So.
And oncologists that can do the if you need the radiation therapy and or the chemotherapy, we have the providers here at Mon Health that can do that too.
Great. We're going to jump to a question from a viewer out there. It says, I'm going to stop breastfeeding soon. How long after can I expect to start my period again?
It really varies. From one patient to another. Sometimes, even when they're breastfeeding, your periods may return. So a lot of times women won't start having their periods again while they're breastfeeding, but once you stop, usually within 6 weeks or so, I would say most women will start to get their period back. If that doesn't happen, then we always tell patients to give us a call so that we can figure out what's going on and make sure that there's nothing else that we're worried about.
Similar, patients will ask similar questions on, stopping birth control pills, right? If I'm hoping to get pregnant soon, I stop my birth control pills. Is there a delay on when I'll have a period again, or, on will I be more or less likely to get pregnant sooner than later? And it does depend, a lot. It varies. Some, their periods come back quickly, they start ovulating quickly, and they can get pregnant quickly. Other times it takes, a couple extra months. But, the first month or two, sometimes things are a little bit weird, and then you get back to your normal self, whatever that may be.
Okay, we're getting a bunch of pregnancy questions, actually. What foods should I avoid during pregnancy?
There's a few that we kind of talk to patients about. I broke some of these rules when I was pregnant, but like deli meats, you're not supposed to eat deli meat while you're pregnant.
Up, right?
You can heat it up if you wanted to eat like a Subway sandwich or something like that. Sushi, raw foods, raw meat is generally not a good thing to do while you're pregnant. So make sure all your meat is well cooked. Make sure all your cheese and
Unpasteurized.
yeah, just make sure it's pasteurized. What am I missing?
Alcohol.
Oh yeah, alcohol, definitely not. There's no safe amount of alcohol in pregnancy that's shown to be safe, so we really discourage that.
I feel a similar question, not on foods, but a lot of people think they're pregnant and they can't do X, Y, and Z.
Yeah.
And really, for the most part, you can do basically the same stuff. Exercising, for example. I think if you're a runner, right? You are a runner. So if you're run several miles per day, if you're running a half marathon, you can keep on doing that, right? I mean, your body will change and you'll eventually not really be able to do that, right? Your exercise capacity kind of decreases, but you can keep on doing that.
Yeah, your center of gravity changes during pregnancy, so I warn patients, just be careful how you're lifting weights, but you can still lift weights, you can still be active. It's actually better to be active during your pregnancy so you avoid some of the complications of pregnancy, high blood pressure, diabetes. Staying active is really important. You can get your hair and nails done. I always tell patients that because you want to look good.
Absolutely.
Yeah.
What about travel?
Travel, yeah. So somebody asked me that the other day in the office, and I think different doctors might have a little bit different opinions on that, on kind of their comfort levels. But I mean, there isn't anything on flying on a plane that's going to make you go into labor, right? So I generally tell, it depends where you're traveling to. I think the more important thing is if you're going to be traveling somewhere out of state, far away, just know where a local hospital is. If by chance you happen to go into labor or have a complication, know where the hospital is. Make sure it's a hospital that takes care of pregnant women and delivers babies. That's probably the most important advice. Sure, if you're 36 weeks, right? I may not venture too far from home, although realistically, labor is typically an all-day event, right? So even if you're down in Charleston, let's say, right, you're 2.5 hours away. That's not far, right? You start having contractions, get in your car and get back to Morgantown. So, that similar question is, well, what if I live in Bridgeport? Can I still come to Morgantown to have a baby? I live, an hour away and maybe I won't make it to the hospital. I live an hour away. I live, 3 miles away and sometimes it takes me an hour to get to the hospital. You know what I mean? So, I think living a far distance from the hospital definitely doesn't preclude you from coming here to have a baby. So it kind of goes hand in hand with traveling.
Is there any restrictions on being able to get on a flight? Because I know when Carly was pregnant, we did a ton of traveling, and she obviously wanted to try to come and see me when she could. Is there a cutoff limit?
I think certain airlines have specific rules that they follow, and I think generally it's around 36 weeks, so usually that's what I'll tell patients, but you might want to check with your which flight, which airline you're flying with to make sure that you can still safely travel with them.
And sometimes we'll write a note and just say, she's currently this many weeks pregnant and having no complications, it's okay to travel, and sometimes having that note in hand is a good idea.
Okay, one more quick question here. How much weight should I expect to gain during pregnancy?
About 25 to 30 pounds is a normal, typical weight gain. Some people gain a little bit less than that. Some people gain more. We track your weight throughout the pregnancy just to make sure you're staying healthy. So we'll be watching and kind of guiding you through that if you're gaining too much or not enough.
However, some people just naturally gain more weight, and there's not much you can do about that, right?
We don't put you on diets.
Yeah, exactly. So we're definitely not anybody that harps on it. Now, if you're going to McDonald's, 3 days a week and you're complaining about gaining weight, right? Maybe you got diabetes and other issues because of your lifestyle, and you need to cut that out. But if you're generally trying to be healthy, you should be fine.
We do have diabetes education here too. I forgot to mention that. If patients are diabetics in pregnancy and they're having a hard time, we have people that we can, go over meal plans and everything with. Yeah.
Awesome. That's all we've got time for tonight. I appreciate you guys joining me, Dr. Prettyman, Dr. Arthurs. It was a pleasure talking to you guys. Everyone have a good night, and that'll be it for tonight.